If your lower back is flaring up and you're not sure what to do, this video is for you. My name is Fardis. I'm a physiotherapist at the MSK Studio in Adelaide, and we help people overcome back and neck pain. Today, I'm going to walk you through 5 mobility exercises I use as a starting point with clients who come in during an acute flare-up. The goal right now is to keep the spine moving gently, reduce stiffness, and start settling things down without making it worse. Go at your own pace. If anything feels sharp or causes symptoms to travel down the leg, stop and get assessed by a health professional before continuing. Now let's get into it. The first one is pelvic rocking. This is usually the first movement I go to with anyone in a flare-up because it's low load, it's gentle, and it gets the lower back moving without putting much demand on it at all. For this, you want to lay down on your back on a firm surface, preferably the floor with a yoga mat or carpet underneath you. Space the feet apart slightly and make sure the head is comfortable. If needed, you can pop a small pillow under the head. What you're doing here is gently tilting the pelvis forward and back. Tilt the lower back down toward the floor. You'll feel a small arch come up and then gently flatten it back down. Forward and back. That's it. You're not trying to create a big movement here. Small and controlled is exactly right. What this does is start to mobilize the lower segments of the spine, encourage some blood flow to the area, and for a lot of people, it starts to take the edge off that deep aching feeling quite quickly. Do about 15 to 20 repetitions, nice and slow. If this feels okay, no increase in symptoms, then we'll move on to the next one. Next is bridging. Bridging is a low-load way to start activating the glutes and the muscles around the lower back without putting the spine under compression. You're going to gently press your feet into the floor and lift the hips up slowly. The key is to roll the spine up gently, like a continuation of the pelvic rocking. Hold for 2 to 3 seconds at the top. Only go as high as what's comfortable, and then lower back down with control. The key here is slow and controlled on the way down. That's where a lot of the benefit is. You're not powering through this. You're just waking up the muscles around the spine and getting them working gently. 10 repetitions, take your time between each one. The third one is the Cobra. Lay down onto your stomach, elbows tucked in and palms flat on the floor. This is an extension movement, backwards bending through the spine. And for a lot of people in a lower back flare-up, this direction of movement can actually feel quite relieving. Now everyone is different. If this direction feels uncomfortable, that's okay. Just go as far as feels manageable and stop there. Resting on the forearms, a gentle extension. See how that feels. If that's okay, you can press up onto the hands and extend a little further. You want to feel a stretch through the spine, not a sharp pinch through the lower back. If you feel a pinch, come back down and stay at the forearm level. 5 to 8 repetitions, holding each one for 5 to 10 seconds at the top. Fourth is the child's pose, and this one acts as a nice counterbalance to the Cobra we just did. Come up to kneeling. Sit your hips back towards your heels and reach your arms forward along the floor. Let the lower back round and relax here. You're not pushing into anything, just letting gravity do the work. For a lot of people, this is a position that feels the most relieving during a flare-up. The lower back gets a chance to decompress and the muscles that have been guarding get to let go a little. If getting your hips all the way to your heels is uncomfortable, place a pillow between your thighs and calves to reduce the range. Hold for 20 to 30 seconds. Take a slow breath in, and as you breathe out, let the lower back soften a little more, and then come back up slowly. The last one is the cat-camel, or known as the cat-cow. Stay on all fours, hands under shoulders, knees under hips. This one moves the spine through both directions, flexion and extension, and it's one of the most effective ways to restore movement through the full length of the spine during a flare-up. On the inhale, round the spine up towards the ceiling, tuck the chin in and let the lower back round. On the exhale, let the belly drop towards the floor, the lower back arches, and the head comes up gently. And just keep moving between these two movements. Nice and fluid. You're not holding either position, you're just flowing between them. What you often notice is that one direction feels more restricted than the other. That's completely normal. Don't force a restricted direction. Just work within what feels comfortable, and the range will often start to free up as you do more. 10 slow cycles. Let the breath guide the movement. So that's the 5. Pelvic rocking, bridging, Cobra, child's pose, and cat-camel in that specific order. Done together, this sequence takes about 10 to 15 minutes and is something I'd recommend doing 2 to 3 times a day during a flare-up. Now this is general information, and every flare-up is different. If your symptoms aren't settling within a few days, or if you're getting pain or tingling travelling down the leg, that's a sign to get a proper assessment rather than pushing through. If you're based in Adelaide and you want to understand what's actually driving your lower back pain and get a plan built around your specific presentation, you can book an initial session at the MSK Studio via the link in the description. And if this was helpful, subscribe for more.